This is the most famous knee in the history, and this is the reason why it's famous. And this is the legend. Ronaldo Nazário Lima, the legendary Brazilian football player. Ronaldo's first knee injury was during his play for PSV Eindhoven. It was in the season 1995-1996. By that time, he was a teenager, only 19 years old. At that age, he was diagnosed with a disease called Osgood-Schlatter disease. Then, what is Osgood-Schlatter disease? To imagine what happened, we need to know more about the structures of the knee. The knee joint is composed of 3 bones. The upper bone is called femur, which is the thigh bone, and the lower bone is called tibia, which is the shin bone. The third is patella, which we call the kneecap. This kneecap lays over the 2 other bones. Patella is the most important part in our story today. The upper part of patella is attached to muscles of the front of the thigh. The lower part of patella is attached to shin bone via what we call patellar tendon. And this is the most important structure in our story today. Osgood-Schlatter disease is an irritation of the area just below your knee. It's called tibial tubercle. This is the site where the patellar tendon is attached. Regarding the age, this condition is more common at the age between 9 and 15 years old. So, what does the patient suffer from? The patient of Osgood-Schlatter disease suffers from knee pain and swelling, specifically over the tibial tubercle. Moreover, this area will be swollen, adding to this tightness of thigh muscles. This condition occurs usually due to extra effort. Physical activity adds more load on the bones and muscles, especially during the growth period. Okay, what is the treatment of this condition? Basically, this condition is limited to the adolescence period. After full maturation of bones, Osgood-Schlatter disease is over. Then, what is the treatment? The main treatment of this condition is taking rest, applying ice, and taking painkillers. Child can do his physical activity normally as long as he can tolerate the pain. However, the management consists of first, stretching of thigh muscles, ice pack application to reduce the pain and swelling. Use the ice for 20 minutes several times per day, but don't apply the ice directly to the skin. Number 3, painkillers like ibuprofen or diclofenac. Patellar tendon strap supports the tendon in place. It is very rare to go for surgical treatment of this condition, and that's exactly what happened to our legend. Back to the story. It was impossible for a key player like Ronaldo to take rest and do the regular modalities for treatment of Osgood-Schlatter disease. So, PSV Eindhoven recommended to go for surgery. And the surgical management of Osgood-Schlatter disease is to remove tibial tubercle. In 1999, Ronaldo was transferred to Inter Milan, and there, the catastrophe took place. During playing a match in November 1999, Ronaldo got a knee injury and a partial tear of the patellar tendon. Now, the question is, what is the patellar tendon and what happened exactly? In general, tendon is a cord of fibrous tissue that attach muscles to bones. We can resemble it to a rope that attach muscles to bone. The function of patellar tendon is to work with muscles in front of the thigh to straighten your leg. Patellar tendon may get torn due to many reasons. For example, direct fall on the knee. Another reason, weakness of the tendon due to any other medical condition, like soreness of the tendon, which we call patellar tendonitis. Sometimes, this tendon inflammation is treated with injection of cortisone. This injection leads to weakness of the tendon. So it's like a vicious circle. Eventually, this weakness makes the tendon more liable to rupture. Weakness of the patellar tendon can be due to any other medical condition, like in the patients with kidney diseases, patients with high cholesterol, and diabetic patients also. Then, what is the treatment of ruptured tendon? Generally, ruptured tendons are treated by surgical repair. So, let's go back to Ronaldo. After a surgery for tendon repair and 5 months of rehabilitation, he got back to play with Inter Milan. His first game after recovery was against Lecce in April 2000. But after only 7 minutes in this match, Ronaldo fell down on the ground, screaming out of pain. He was taken out of the pitch on a stretcher. The atmosphere was very tense by that time, and unfortunately, he was diagnosed with complete patellar tendon rupture. That time, the injury was a major one. It took around 2 years for recovery. Such repetitive injuries and surgeries are more than enough to end his career as a football player. However, it was not the end. After this long history of serious injuries and surgical repairs of the right knee, no one expected that Ronaldo can play football again. But he was able to lead Brazil national team to the title of World Cup in 2002. All these injuries affected Ronaldo's right knee. But what about his left knee? Actually, his left knee was not spared. In 2008, Ronaldo got left patellar tendon rupture. Since then, his shine started to fade gradually till his retirement in 2011. In spite of his short career and the repetitive injuries, he was able to make himself a legend in football. And here comes the end of patellar tendon and the Osgood-Schlatter disease stories. So, do you know a similar story? Tell me in the comments. At the end, if you like the video, hit the button, share and subscribe for no reason. And if you are on TikTok, follow me. I'm Dr. Muhammad Ali, and this is my channel.